estimated 20 million people in the United States have type 2 diabetes, and maybe the scariest part is oftentimes the symptoms are overlooked. But here to help, Dr. Justin Kolarko with Southwest Medical Associates. Thank you so much for joining us.
Thanks for having me.
So these symptoms, often really mild, so people just think, it's nothing.
Yeah, a lot of people will have diabetes and they won't even know that things are going on. So they'll have frequent or often urinate in the middle of the night. They'll have excessive feelings of thirst, excessive feelings of hunger, even though they've eaten appropriately for the day.
All right.
They may start getting some blurred vision.
You get really tired, too, I understand.
Yeah, you get tired. You get poor or delayed healing of some wounds or cuts that should normally heal up without any problems. You can even start losing some weight sometimes when you're eating appropriately.
People are like, yes, but it's not a good sign if you're thinking about diabetes.
Right, it's not always
and I
good.
understand controlling the disease now, at the beginning, can help your health later on.
Yeah, you want to start off early on, catch everything early on, because diabetes is bad enough as it is, but then it also has all of the systemic side effects. So it can lead to the blurred vision. It can even lead to loss of vision or blindness. It can lead to teeth and gum problems. It can lead to cardiovascular and neurologic problems. So centrally, meaning that would be stroke or heart attack. You have an increased risk of that.
So trying to keep everything under control now kind of keeps those other problems maybe at bay, at least for longer.
Exactly.
All right, and I know that you're actually a podiatrist, and there's a lot of foot health that goes into treating someone with diabetes. So how do you work with your patients?
Yeah, that's what I see almost every day. You know, 50% of my patients have some kind of diabetic thing going on.
Interesting, okay.
A lot of the things you can do to manage your foot health with diabetes, the most important thing to do is to work together with your healthcare management team, make sure your blood sugar is in good standing order, which typically nowadays means 70 to 130 on your glucometer. Your
Why do you say nowadays? Has it changed?
ADA always moves it around.
Okay,
and keep lowering it and moving it around, but the tight blood sugar control is now 70 to 130 in the blood sugar range on your little glucometer meter if you're checking it.
Okay.
For the foot itself, checking your foot every day. So if you can see your foot, make sure you're checking it every day. Set a time. Make sure you're looking at it at the same time every day.
Oh, wow, okay.
That way that you can stay on top of it. You're looking for changes in the foot, wounds, cuts, scrapes, blisters, any structural deformities that might not have been there the day before, some redness or swelling. You always want to keep a close eye on the foot.
What if they show up?
If they show up, you want to contact your health professional immediately, get into the office, get seen. At least even with your primary care so they can direct you in the right location. If you can get in or you're established with a specialist, get in to see your specialist so that you can take care of that issue immediately. Don't ignore it and put your head in the sand.
It's just something that affects so many people, I think.
It does. It's a large portion of our population. It just keeps growing. You know, the other things you can do with your foot health is make sure that you're always wearing shoes, especially out here in the desert.
Oh, yeah, and keep active can help, I know that, too.
It gets to be super hot. If you're not wearing your shoe, I see probably 2 or 3 a year, third-degree burns, just going to check their mail.
See, that's why I have fabulous shoes all the time.
Right.
All right, thank you so much, Doctor. We'd like to thank Southwest Medical Associates, of course, for being one of our Community Pride partners.